All right, so we're going to do a presentation tonight called COVID-19. It's the basics about how to keep yourself and your family safe. My name is Dr. Valda Crowder, and I'm an emergency medicine physician. I've been an emergency medicine physician now for 30 years. I also, through a company called Capital Health Partners, provide expert medical review for all the medical malpractice cases that come out of the Virgin Islands for their Attorney General's office. I have my contact information down there, and we're going to try to go through this I'm going to kind of go over what the basic structure is. We're going to do a slide presentation. Will be 20-25 minutes. Then after that, I'll open it up and it'll be Q&A. At the end of it, it should be no longer than an hour as we go through everything. This presentation, we're going to do it on Tuesdays and Thursdays throughout this epidemic. And we're going to put up a calendar so everybody can see when and where we're doing this presentation and other events. Now, everyone is muted. You can ask questions through the chat box. You can also raise your hand. Here's how to actually do that. Please be patient with me. I'm doing the presentation, answering questions, and trying to figure out what's in the chat box. So please be patient with me as we go through the Q&A piece of it. So now the intention of this is to keep all webinar participants informed with COVID-19 science that will help you and your family stay healthy during the pandemic. The outcome of this presentation is that you'll leave the webinar motivated to create an action plan for you and your family. And then once you create an action plan for you and your family, you are motivated to create an action plan for your broader community. So that is the goal, that you actually be armed with the science, so then you actually can know what to do and create a plan for yourself and your family and your community. All right, so I'm going to not read this slide. I'm gonna allow everyone to please read this slide, and I'll give you a moment of silence to read it. So this was a quote by the Director General for the World Health Organization. And I think it's very important because it actually signals the seriousness of this, but also that we can actually still have things that we can do to make a difference. So what is a pandemic? A pandemic is a worldwide spread of a new disease. The new disease must be an infection and also be contagious. And it is a new disease that people do not have immunity to. Examples of pandemics are smallpox, polio, tuberculosis, HIV, bird flu, which is H5N1, SARS, which was also a coronavirus, and MERS, which was also a coronavirus. Now, what happens in pandemics is they impact everyone. And so this is a list of sovereigns that were killed by smallpox. As you see from this list, it spans anywhere from Spain to Russia to France, etc. Today, we're seeing people and leaders become positive. Just recently, Prince Charles, etc. COVID-19 is an infectious disease caused by a recently found virus known as SARS-CoV-2, or coronavirus. Before the outbreak, this originated in Wuhan, China, during December 2019. But prior to this, there was no information about this virus. So what is COVID-19 and why is it called that? CO stands for corona. It's Latin for crown or halo. If you look to the right, the two-dimensional view of this virus actually looks like a crown or a halo. VI stands for virus. D stands for disease. And 19 stands for 2019, which is the year that the strain appeared. So hence you have the name COVID-19 given to it by the World Health Organization. Why is this so important? We have all experienced a pandemic before. If you're over 65, you may have experienced more than one pandemic. There are two final outcomes from a pandemic. One, a complete cure or near complete cure. That occurred with smallpox, which was eradicated in 1980. It also occurred with polio, which is near complete eradication. HIV is a second type of outcome, which there's no cure, but you have some type of containment or management. So those are the two outcomes. Coronaviruses are not new. They've been around now since the 9th century BC. This particular strain is new. Now, how is coronavirus spread? It's people and surfaces. So the disease spreads by person to person through small droplets of the nose and mouth, and those small droplets land on surfaces, and then people may touch their eyes or mouth or nose. I tell everyone to respect COVID-19. Why? 1, it's a droplet disease. 2, it stays on surfaces for a very long time. On cardboard boxes, it can stay as long as 24 hours. On plastic surfaces, it can stay as long as 96 hours. High traffic surfaces, you really want to look at high traffic surfaces, doors, knobs, handles, debit card pin pads, gas station pumps, phones, hospital workers, their shoes and their scrubs. These are the sorts of places where people are picking up COVID-19. COVID-19 also needs to be respected because it is highly, highly contagious. How do you actually calculate contagiousness? 1 is, what is the minimum amount of time of exposure that one needs to infect others? For COVID-19 is 45 seconds of exposure. Percent penetration. So out of how many people who have the disease then give the disease someone they're in contact with? That is 60 to 80% penetration. So these two features actually make it highly, highly contagious. Let's talk about how to prevent it. We're going to go over 3 categories of strategy: preventing it, prevent spreading it, and then what happens if I actually get it, if myself or my family get it. So there's been a lot about proper hand washing. These are actually the 8 steps associated with proper hand washing. I put up this slide because many people actually do number 1 and maybe number 2. But most people are not doing the back of the hands, they're not doing the thumbs, they're not doing their fingers, they're not doing their fingernails, and they're not doing their wrist. Sorry about that. Then social distancing, which is the next slide here. When we have our normal daily activity before we did all this social distancing, one person would, in 5 days, infect 2.5 people, who then in 30 days would infect 406 people. If we decrease our social exposure by 50%, then one person in 5 days infects 1.25 people, and in 30 days, only 15 people. If you go down to 75% less social exposure, one person then actually infects 0.625, and then in 30 days, 2.5. This basically goes over all the things to protect yourself from coronavirus, which we're gonna go over this plus some more, but these are the things that you've heard of. Proper hand washing, social distancing, don't touch your eyes, nose, and mouth. If you're going to actually cough, make sure to do it with a bent elbow, and obviously seek medical attention if you need it. Now, I'm going to go over some things that I think need to be done in addition to CDC guidelines. So these are what I call Dr. V's guidelines. 1, do not go to the grocery store. Do not go to the grocery store. Order food and medication online. For the elderly that are not on the computer, call them and walk them over the phone how to order their groceries and medications online. If someone is elderly and not able to get on a computer, consider having them send you the money or mail you the money, and then you order the groceries and have them delivered to your loved ones. Now, what happens when you actually get food or groceries delivered to your door? There should be no contact with the delivery person, not even a handoff. Bring the delivery into your home and put it on your floor. Do not put it on a table or a countertop. Get rid of the bag immediately and transfer any food into your own Tupperware and your own containers. Clean highly used surfaces in your home frequently. Avoid using cash. Cash is another highly trafficked surface. If you're using your card for anything, you're putting it in the PIN card machines, just make sure that you actually wipe down your cards. Do not get together in small groups with your extended family for holidays or celebrations. I know Easter and Passover are coming up. It's very, very important that you actually do not get together with extended families. We are seeing people get coronavirus in clusters and losing multiple family members. Missing your personal care services. Well, so am I. Please do not go to anyone's home to get your hair or nails done. And please do not allow anyone to come to your home to do your nails or hair or face or massage. It's just not worth it. Now, let's talk about risk factors, because there's been a lot of talk in the news about risk factors, and I want to actually clarify risk factors. One, any person that is 65 years or older. Now, they talk about the elderly. The criteria is 65 years or older. So if you were born on or before 1955, that is you. I've had a lot of people say, well, I'm not the elderly because I go to the gym every day. I'm not the elderly because I run marathons. I'm not the elderly because I still work and I'm not retired. Born on or before 1955 is a risk factor. Two, people who live in nursing homes or long-term care facilities, that is another risk factor. Now, other high-risk conditions, any sort of lung condition, whether or not it's asthma, COPD, any sort of lung condition, and also any heart disease with complications. Anyone who is immunocompromised, maybe someone who is getting chemo treatments for cancer, anybody who is HIV positive. The other risk factor that is not talked about a lot is people of any age with severe obesity. So obesity is defined as a BMI or body mass index greater than or equal to 40. I will go over what that actually looks like, but anyone, any age with a BMI over 40 is a risk factor. Pregnant people should be monitored, since in general, they are known to actually be at increased risk for viral illnesses. However, the CDC has not yet actually named it as a pregnancy as a risk factor. So let's talk about BMI, because this is a risk factor that involves everyone of any age. Here is what a BMI greater than or equal to 40 looks like. If you're 5'2" and you're over 220 pounds, if you're 5'6" and you're over 250, you're 5'10" and you're over 280, if you're 6 foot and you're over 300 pounds. And it doesn't matter if you think I'm over 300 pounds, but I'm in good shape, it doesn't matter. Now, for men are at higher risk for getting the disease, and once they get it, they do poorly. So let's take a look at this. When you actually look at COVID-19 infections, 58% of them are men, 42% are female. That's from New England Journal of Medicine. Death rate, 2.8% of men infected with COVID-19 die versus 1.7% of women. So men are about 40% more likely to die of COVID-19 once they contract it. Now, we don't know exactly why men are at increased risk, but this is one of the things. Facial hair. So facial hair is actually a surface that has been known to collect COVID-19 and give people an infection. So my guidelines on this is to just get rid of it. If you have a mustache or you have a beard, just get rid of it. It's not worth it. Okay. CDC has a whole different guideline. Now, this is a chart from the CDC. It's very complicated, but it goes over what are the ones that are the okay facial hair to have because of the green check mark here versus the ones that aren't, and all the different types of cuts have names to them. So I show you this to let you know that it exists. I would personally I think it's probably better just to get rid of all facial hair. All right, clinical outcomes. 1,590 COVID patients in China. One risk factor increased the likelihood that a patient would require an ICU or a respirator or would die by 79%. 2 risk factors increase the likelihood of requiring an ICU, respirator, or dying by 250%. Let's look at, a couple people have asked me, well, are certain risk factors more important than others, or does certain risk factors, do they increase your likelihood of dying more than others? So this actually segments everything by death rate. This is, if you're healthy, there's no risk factors, 9 people out of every 1,000 who get COVID-19 would actually pass. So as you can see, cardiovascular disease is probably one of the biggest risk factors. Now, let's talk about folks with asthma and those that are caring for them. This is very, very important. You want to, during this time period, avoid using a nebulizer. Someone who has a history of asthma and then catches COVID-19, you cannot distinguish between if they're having an asthma attack or if it is related to like a viral bronchitis or a viral pneumonia from COVID-19, okay? COVID-19 is a droplet disease. If someone who is actually COVID-19 positive then uses a nebulizer, it becomes aerosolized, which means anybody in the home breathing it will actually become infected. So even in the hospital, in the emergency department, we are not giving nebulizer treatments under any circumstance. So what you do instead, you can use a spacer or an aero chamber. This is what it actually looks like. You put the inhaler in here, you give yourself a couple puffs, and then the medication goes in here, and then you breathe in and you breathe out. An inhaler with an aero chamber has been shown to deliver just as much medication as a nebulizer. Women who are pregnant and near delivery. People who are pregnant should be monitored since they're known to be at increased risk, but the CDC has not actually determined that that's an actual risk factor. I think that my recommendation would be for anybody who's considering, who has a healthy pregnancy and wants to know what to do, I would consider a home delivery with a midwife. Action plan. What if I think I have COVID-19? What are the symptoms? So one is you can be completely asymptomatic and have this infection and spread this disease and not know it. Some people actually get only a sudden loss of taste or smell. There are also COVID-19 symptoms that are gastrointestinal symptoms, nausea, vomiting, diarrhea. Then there's the respiratory symptoms that we actually hear about on the news, with the upper respiratory symptoms being headache, fever, achiness, and the lower respiratory symptoms being more like a pneumonia, fever, dry cough, difficulty breathing. What does it mean to self-quarantine? Okay, so if someone is COVID-19 positive and they're told to self-quarantine, that means literally stay in a room or a garage or somewhere where you are separate from the rest of your family. It's important that you stay in the room, do not leave. Your family can leave food by your door, and a minimum of 14 days. I would recommend 21 to 30. What not to do? I just saw some patients last weekend in the emergency department. I had someone who I thought had COVID-19. I went through everything about self-quarantining. He wanted to know if he could go past the drive-through at Bojangles. You cannot go anywhere. You have to go straight home to a room and be somewhere separate, okay? So do not think that because you have on a mask, you can still walk around the house or do the things that you normally doing. Self-quarantine actually means you're going to be in a separate room continuously. Well, some people are sort of saying, well, why don't I just go ahead and catch it and get immunity? So not particularly a good idea. One is, we have not determined that if you catch COVID-19, you will actually get lifelong immunity. It seems like you'll get some sort of temporary immunity that is going to wear out over time. COVID-19 sits in the lungs and appears like ground glass by CAT scan. It causes pulmonary scarring and fibrosis. Those who get viral pneumonia have a 50% death rate. Many people who are recovering from viral pneumonia, about a third of them have decreased lung capacity and have problems with normal walking, have problems breathing with normal walking. So it is not something that you want to just catch in order to get immunity. How to win: early detection, early response. Universal precautions. I want to explain what universal precautions are because all of us on this call can implement universal precautions. Universal precautions mean the following. I assume I have COVID-19 and I act accordingly. I assume you have COVID-19 and I act accordingly. You assume you have COVID-19 and act accordingly. You assume I have COVID-19 and act accordingly. So what is next? We will continue the social distancing until we've turned the corner. Australia actually did their social distancing and shut down for 6 months. If your employment is significantly impacted by this, I really recommend that people look at what they can do remotely, or some folks may have to get an actual different job. A vaccine is 12 to 18 months away, and that would actually be quick. Stay informed, stay alert. I recommend probably the best site on here is the World Health Organization. You will sometimes see conflicting information, but I find that the World Health Organization is really probably the most reliable source. You'll also see things where on the news where they're kind of conflicting. One day the CDC says they're considering asking people to cover their face in public, and the other ones, the Surgeon General urges Americans to remain at home and masks don't need to be worn by healthy people. I actually recommend that you actually do the thing that is most conservative. So I would wear a mask in public or a scarf or something and cover my mouth and nose. And that is what I do. What to do if you think you have COVID-19? There's also stuff around not using Motrin, Aleve, and ibuprofen. World Health Organization said avoid taking it because it actually made the symptoms worse. Then later on, they walked back the advice. I'm actually recommending that people actually just use Tylenol. Paracetamol is Tylenol. This is Tylenol. So I'm actually recommending that if people get sick, they just use Tylenol unless they have some real reason to use Motrin. Do not go to the hospital unless you are really, really, really sick. I remind people that the emergency department, the hospitals, the medical floors, the ICUs, all have people with COVID-19 in it. So if you're thinking, geez, I kind of really want to go to the emergency department and get this thing or that thing checked out, you have to decide, is it worth possibly catching it there, or should you just stay at home? Okay. 2, aggressive testing guidelines. Unfortunately, the testing varies state by state. Ideally, we would have a consistent policy across state lines. This is going to dramatically make a difference and slow down our ability to actually get ahead of this infection in how we're actually dealing with the testing. So I wanted to actually, just on the testing, there was a town in Italy, Voie, Italy. Originally what they did was they only tested the symptomatic people and they could not get rid of COVID-19. Then eventually, against public health advice, they tested everyone. When they tested everyone, they found about 10 to 12% of the people that were positive with COVID-19 were asymptomatic. They quarantined those people for 14 days. After they quarantined them, they still had about another 10% or so that required an additional 7 days of quarantine. So that's why I'm telling people 21 days if possible. Okay, I've already gotten some phone calls from people who have had family members that are actually sick. I have, this is all of my information. This phone number, this 833 phone number will be up by Friday. I will be answering questions of people that actually have a family member in the ICU and are struggling, and I will be calling those folks back first. So if you call and you don't have a loved one in the ICU, please be patient with me getting back to you because I do need to tend to those that are in the ICU first. This is what the website looks like. You can send us a message there. This is what the Twitter looks like. respect COVID-19, create a plan for you and your family. That is the end of the presentation, but I did get asked a question about the impact of religion on the pandemic, so I'm going to actually deal with that question up front, right? Unfortunately, religion has over time played a negative role in helping. It's almost been an obstacle to get around. So for instance, with smallpox in India, children with smallpox were considered to be good luck and good fortune for the family. So when the public health workers came around trying to figure out if you had a child in your home with smallpox, many people didn't want to tell them because they really didn't want the disease stopped because they thought, I want the good fortune that's going to come by having a child with smallpox. Similarly, as many of you know in the news, COVID-19, Iran is a hotspot. Iran is a hotspot because in January, 700 Chinese visitors visit a religious spiritual monument in Qom, Iran. This particular monument, in order to pay homage to this monument, you kiss or lick this monument. So, as you can imagine, people were kissing and licking this, and that is how Iran became a hotspot. The government tried to actually shut down the this spiritual monument, and the community has been against it. So even to this day, right now, this spiritual monument is open, and people are kissing and licking it. All righty.